the fourth and final installment of Don't Diss My Ability. My name is Tori Gordon, and I am a second-year master's student at the North Carolina Agricultural and Technical State University. I am pursuing my master's degree in rehabilitation mental health counseling. I am here today to talk about chronic pain. Chronic pain means that someone is experiencing pain on most days or every day for at least 6 months. According to the CDC, chronic pain is one of the most common reasons adults seek medical care. It is estimated between 11 and 40% of US adults live with chronic pain, with 8% experiencing high-impact chronic pain. High impact means that the pain has limited their life or work activities. Chronic pain is more prevalent among women, non-Hispanic white adults, adults living in or near poverty, and those without a bachelor's degree. It is more likely to impact people over 65 years old, but it does occur in all age populations. People with chronic pain are 3 times more likely to develop depression and anxiety, and these patients have at least a 2 times higher risk of suicide. In the US, the estimated annual cost of chronic pain is $100 billion, and it is the #1 cause of disability and disease burden globally. Chronic pain is an important subject for me because I suffer from high-impact chronic pain. As a teenager, I was diagnosed with severe scoliosis. My spine was twisted in the shape of an S. After wearing a hard plastic back brace for over a year, my scoliosis had become too severe and they had to operate. I now have had 4 spine and neck surgeries, resulting in 12 spinal fusions. Here is a picture of my MRI. This has caused me to suffer depression, and I had dropped out of my undergraduate studies and felt hopeless for many years. If you think you have chronic pain, please talk to your doctor because it is treatable. The best treatment is a multidisciplinary approach that combines physical therapy, medications, psychology, and exercise. Psychological therapies include mindfulness, cognitive behavioral therapy, and acceptance and commitment therapy, also known as ACT. These have been proven to reduce pain and increase functioning. For me, finding a trusted doctor, consistent prescription medications, ACT therapy, physical therapy, movement, and a job with a flexible work schedule has helped me reduce my pain and overcome the depression and anxiety and find a life with purpose once again. Sometimes people with chronic pain are labeled as complainers, drug addicts, lazy, or weird. While minor aches and pains associated with aging are normal, chronic pain is real. Taking opioid medication is a controversial subject, but there are many other medication options to try, and studies have found that taking pain prescriptions directly as prescribed rarely causes addiction. Opioids, nonsteroidal anti-inflammatories, antidepressants, anti-seizure medications, and benzodiazepines, or a combination of these medications, are all proven to help different types of chronic pain. Speaking personally, I take opioid medication, antidepressants, and a muscle relaxer daily for years, and this combination of medicines enables me to function as a student, work part-time, take care of my fur babies, and run a household. Chronic pain is exhausting, and oftentimes we have trouble sleeping. Sometimes we'll need to nap or take rest breaks throughout the day. And last, sometimes chronic pain patients are labeled as weird because we have different movements or complete tasks differently. I sometimes need to lie down on the floor during class, stand up, or do stretches. Accepting my differences and not being judged by my peers, professors, and bosses enables me to achieve my goals. Finally, I want to discuss social injustices associated with chronic pain. Research has found that Black patients are chronically undertreated for pain symptoms compared to their white counterparts. Pain Medicine Journal found that Black patients were 14% less likely to receive opioid drugs after surgery and 34% less likely for non-surgical pain than white patients with the same maladies. There is an incorrect assumption in the medical field that Black patients are more resilient to pain. A study published by the Journal of Experimental Psychology found that white study participants were less able to perceive painful expressions on Black patients, meaning that white doctors and nurses are more likely to incorrectly interpret pain in their Black patients. We can avoid these biases by requiring healthcare professionals to take educational courses on implicit bias. We can create standardized checklists of appropriate care for patients to help avoid individual bias, and we can find a more objective measurement of pain in self-reports that would reduce disparities. Pain is complex and personal, and finding appropriate treatment is hard under the best circumstances. It is important we all educate ourselves about each disability and understand our own biases as we strive towards equal treatment for all.